Dr. Maier, I am so thrilled to welcome you to the Wellness Roundtable. Thanks for beaming in from Singapore. I know it's late there, and this isn't even your last call of the day, so thank you.
Happy to be your guest, and I'm very, very much looking forward to have the conversation with you and hopefully a very nice discussion about this increasingly hot topic.
Yes, and you occupy a rare role in that you're a researcher, you're a clinician, and you're an entrepreneur. You're a legend in the longevity world, and you started in this field really early, which I also think is pretty rare. So I'd love to start with your early career and how you got interested in geroscience as such a young student. Were there mentors or early experiences that inspired you?
Yeah, when I was studying medicine, I was a little bit bored. and so I said, okay, maybe I should study homeopathy, which I did, and it was not for me. And I studied traditional Chinese medicine. So I did all the courses and went to China, practiced. I thought, maybe not for me. And then I thought, okay, maybe also let's do research. And I started with research projects, which were not very successful. And at a certain time, I met people who in the end were mentors for me. And they said, okay, why shouldn't we look at the immune system of all the individuals? And that aligned with all my experiences. And then I started to work in the lab and discovered lots of things. And yeah, step by step, here we are.
And that was all in Germany, and now you're in Singapore. How did you end up in Singapore?
Many different steps. I studied indeed in Germany medicine. I went to the Netherlands and to many other countries to do my specialization in internal medicine, to become a specialist in internal medicine and geriatrics, and then around the globe, lots of collaborations. And then I went 5 years to Australia and then to Singapore. And Singapore hired me, I think, to help to optimize the health of aging individuals. And that's what I'm doing. So I'm here because there is a need, people want it, and there are lots of opportunities.
And in 2023, you started Chi Longevity. I'd love for you to explain that concept to our listeners.
Yeah, it started 18 years ago. I was in internal medicine. I did my rotations and I saw my geriatric patients. I said, this is something. These individuals, they really want to live, but they already have 5 or 10 diseases and 20 pills. And very often in the outpatient setting, I was exposed to either their friends who were a little bit younger or even their other family members. And most of the times, older individuals came with 50 or 60-year-olds. And I thought, I would love to also talk to you to see how could we prevent actually that you also have dementia as your mother or your father at this moment in time. And I got the idea we have to do something much, much earlier. And this is actually the point when with a loved one, you're coming to an outpatient clinic and a disease is being diagnosed, and a terrible disease like dementia or heart failure or something else. You don't want to be sick. Like, isn't that point where that other person could learn from it to prevent that? So I wrote a business case and to screen everybody who's coming with a patient to the hospital because I wanted to prevent that they also become sick in 10 or 20 or 30 years time. And I can tell you, I called it early warning clinic, and it was heavily rejected because everybody was saying this is not going to work out. Like, these are healthy people. Healthy, do you know what healthy is? I said, yeah, but healthy is not healthy, so we have to change it. Let's keep them healthy. Why should only sick people come to our hospital? So lots of revisions, but it did not work out. So that led to many other attempts to bring preventative medicine into the healthcare sector. And in the end, yes, there's Chi Longevity. And Chi Longevity is an evidence-based clinic. In my view, everything should be evidence-based. We need to know that it works in humans. We have to have the trials. We have to have that understanding that's clinically effective. And in the end, it should also be cost-effective. And everything we know about the biology of aging, about how we age, how we measure it, how we can intervene. That's what I'm bringing into Chi Longevity. It's a private clinic. We have one which was started in 2023, and we opened another one actually this year in the Four Seasons in Singapore. And now we are crossing the globe with Chi Longevity because I think we found the way how to do it. We have lots of recipes for medicine, so standardized operation procedures, and are really evidence-based healthy longevity medicine or precision geromedicine is the way to go and to change healthcare. And that's what we do with Chi.
That's amazing. Can you maybe paint us a picture of a typical patient and what their Chi longevity experience would be?
Yeah. So a typical client will be 55, C-level, male, 70% are male. But I think very important to mention is that precision geromedicine or health and longevity medicine is really tackling all individuals at all age ranges. So you should be adult. Everybody who reaches the age of 18 or 21, it depends on the country, is welcome to come to a evidence-based precision geromedicine clinic such as Chi. Independent if somebody already has a disease or has no disease and wants to prevent that disease. But at this moment in time, male, 55, knowing, hey, I don't have the capacity anymore physically, but also cognitively. I'm not as equipped. How can we change that?
And so you would do diagnostic tests. We're seeing a lot of these diagnostic centers pop up in the US. I'm wondering if there's anything specific to Qi around the diagnostic or therapeutics that you might want to talk about.
So we are talking about gerodiagnostics, which means gero is aging and diagnostics is measuring something. So measuring the aging process. And then we are talking about biomarkers of aging. So biomarkers of aging are nothing else than measurements which can detect how old you are and how affected an organ or a tissue or something in the body already is. Even the mindset has a biological age. It doesn't have to be physical. So while measuring these approaches, everybody can do that. Everybody can order a whole body genome scan. Everybody can say, okay, I want a whole body scan of all the organs, and whole body MRI, for example. It's very easy to do because the technology is already there. And I think the differentiator of longevity clinics is and will be, what do you do with the data? How do you interpret the data? How do you bring the data together? So we are building digital twins. We are combining the genetic data together with the expression of a cell, for example, in proteomics, what kind of cells we see, how old they are, where they are. And we are combining that with normal path lab data. So you're getting a blood draw and you get your HDL and you get your cholesterol level and you get your hemoglobin level. So all the things every GP can already do. And we are combining that already with each other and combining that additionally to clinical data. Think about smell, think about vision, think about perception, how you feel, if you can feel with your fingertips, for example, at this moment in time. With your cardiac system, think about pulse wave velocity. So the clinical phenotypic characterization. And it's not only that we are talking about in getting the biology done together with the clinical phenotypic data, but we're also equipping our clients with digital phenotypic characteristics using wearable devices, for example, a smart ring or a smart watch or a continuous glucose monitoring system. So we are bringing technology and adapting that and measuring physiology in our patients, which means that we now know if I have a patient with an Oura ring measuring sleep and measuring physical activity, I have the clinical data, I have the genetics, I have everything else, then I have to make something out of it. And that's the differentiator, because everybody can just buy a smart watch and a smart ring, but what to do with it? That's, I would say, a little bit the IP.
Wow. So you actually have a way to ingest all of this data and interpret it.
Yes. And we are measuring, watching our clients if we want. And of course, the client wants it 24/7 because all the variable devices are included in our EMR. So we can continuously watch what people do, which means then from an interventional point of view, this is very important because we can directly nudge. Every morning we can see how was the sleep. Okay, should I be in contact with the client or not? To nudge and to ask, okay, how was your dinner yesterday? How many glasses of alcohol did you drink? Did you go to the gym? Because we even do not have to ask that because we have it measured. We know if somebody's in the gym, we know what the sleeping time is, we do the analysis, and we don't have to ask so many questions, but we can come with a solution. And I can tell you all our clients are time poor. So time is the greatest asset we have. In my view, you cannot buy time at this moment in time. So we are reducing the time to actually optimize the health by bringing technology in.
And presumably you had to design that electric medical record yourself?
Yes, it's designed because it's just not available. I would
Not
love
available.
to have a sort of Cerner or Epic. So these are the big electronic medical records for the normal medical system, but they are not equipped for these kind of analysis, or at least not yet.
Yeah, it seems like you've solved the problem that a lot of people are talking about of how do you make sense and synthesize all of this data that we're getting from our wearables. Well, let's talk about one of the really big questions in longevity, and that's around whether aging is a disease or whether it's an unavoidable decline that's going to precede our inevitable death. What are your thoughts there? You have said on your website, aging is a disease that can be treated, and I'd love for you to unpack that point of view for our listeners.
Yeah, it depends a little bit on the audience. I think it's a little bit semantic. For me, as somebody who's driving the field, I need to have a disease to diagnose something and to treat something. So I'm really putting now my hat on as a physician, not me as a human being, but me as a physician. As a physician, I know that I'm diagnosing something. So I'm doing that with gerodiagnostics. I want to treat somebody and to lower the biological age of a person. So,
Mhm,
what do I treat and what do I actually write down if aging or the conditions associated with aging are not a disease or a condition I can actually write down? What should I write? I will give you an example. We have COPD, which is a lung disease, and we know how to define it. We have hypertension, we know how to define it. We know what we are talking about when we are talking to other physicians. Clients know what hypertension is, high blood pressure. So we need to define, first of all, what we are talking about, because we need to speak the same language in the medical field. And here I have the hat on as a medical doctor to be able to find not only the right diagnostics, but also the right treatments. Because if you haven't defined what you want to treat, how can you treat something? And very importantly is also that treatment is good, but measuring if the treatment worked is
mhm,
even more important, because otherwise, in my view, it's also unethical. So while not wanting to be unethical, but being a doctor, want to diagnose, I have to call something a disease. And therewith, everything what is aligned with aging, you can measure with biomarkers of aging, and it's being expressed via hallmarks of aging, we are calling a disease. And that's the reason why we are hugely arguing with the WHO to have aging as a disease being recognized. And we already have codes like the XT90, which we are now using in clinical practice to see what the severity is of the aging process. And the
mhm,
severity of the aging process is nothing else than saying you are aging faster or you are
mhm,
aging slower. Because if
mhm,
somebody is aging faster, it's very likely that their biological age is higher, which means you're older than your chronological age, what's in your passport.
mhm,
And then the risk of having a little bit later diabetes or high blood pressure or cancer or Parkinson's is much, much higher. So, therewith, we could treat it. And something is a disease if we try as physicians to intervene with it. So, in the end, I don't want to call everybody a patient, because everybody listening at the moment, I can tell you, nobody's escaping the aging process. So, if you apply my definition, everybody is sick, but everybody should at least know how fast you age, where, and if you would like to do something about it. And a WHO guideline in calling aging a disease enables me to do that. But what I do not want is to call everybody disease, that everybody is listening to the podcast. It will be all right. Don't be depressed. But we just have to now tackle it in a way that we can optimize the health.
And you referenced some of these clocks. I think this audience will know epigenetic clocks that measure telomere length, but maybe not some of the other clocks that get really specific around measuring biological age of different organs. Can you talk to us about the different clocks that you use at Chi and how someone who's listening to this might avail themselves of this technology?
Sure. So, clocks is nothing else than saying how old somebody is and how you are functioning compared to your peers.
Mm-hmm.
And it's a little bit a hype. We just call it clock. Like if you are 45 and your clock says that you are 49, then you are 4 years older compared to where you should be, compared to your peers. That's what a clock is doing. Calling it clock is nothing else than actually risk prediction. So what we do is we first, roughly 10 years ago, we said, okay, can we predict how old somebody is? And we call that first generation clock. I would say that's silly. Why should I predict how old I am chronologically? Because, hey, I know that I can look at my passport, but it was the ability to actually show that we can measure something which is associated with a chronological age of a person. That's it. Then we developed clocks which can predict death. There it becomes already a little bit more interesting. So, can we measure something at this moment in time in a 45-year-old to predict if that person will become 65 or 75? I think that's quite reasonable to know that. So, we developed then the second generation clocks. Many people do not want to wait 20 or 30 years to know if they're going to die. So the third generation clocks therewith predicted the incidence of a disease. So do you become a patient for a certain organ system? So if I measure one thing, can you predict if you become a diabetic, or if you have high blood pressure, or if you develop, for example, early dementia? That's very, very relevant because that's the stage before you die. So that's the third generation clocks. And these are the ones we are using hugely at Chi, because we want to make sure that person at higher risk of having a disease, of having osteoporosis, etc., developing that, to prevent that, because we don't want that disease happening. So how do you do that? Very often it's said, okay, you have to measure the telomeres. I can tell you at Chi, we do not measure the telomere lengths because it's a very, very poor predictor on individual level. In the past 10 years, we discovered that very often something works on group level. So you're comparing a 60-year-old group of persons versus 40-year-olds. Yes, and it might be that the 60-year-olds have a lower telomere length compared to the 40-year-olds. But it doesn't mean that this holds if you are looking into the group of 60-year-olds, that it also is a strong predictor. So telomere length is not very predictive if you are just looking at one individual. However, epigenetics, so that's if you're looking at your genes where little spots are which have methylation sites, so you can switch on and off genes. And we are looking at more than 940,000 of these sites to say, okay, which genes are being used. We invented clocks, an epigenetic clock. We are using a couple in clinical practice because all the different clocks using epigenetic data predict something else. And they are based on something else. I only come up now with an example. You have lots of apples, but you have different apple species. You have the Granny Smiths, you have the red ones. And this is a little bit how it works also in the epigenetic field. You have different things which are differently being used. So also here, like if it's being sold over the counter, people might not know what they actually buy because one epigenetic clock is absolutely not the other epigenetic clocks. In research, we are using more than 30 of these epigenetic clocks, and every day there's another clock coming in. So you need to know if you're using an epigenetic clock, what do you actually use? But I would leave all these clocks measuring it on blood-based parameters, I would leave it out. I would say that the best clock we have is physical functioning. If I would put you on a treadmill, how good would you be to measure your energy, and how good would you be in your performance, in your endurance? We call that VO2 max. So how good somebody is to actually produce energy by the mitochondria and therewith be able to function. And that's the best marker for health in the longer run. And very nicely, you can optimize that. So if you are much, much more on the treadmill, I will do this night after the next call, absolutely, because this is important. We can change it, and we see changes over a couple of weeks. So if we are talking about clocks, it's not just telomeres, it's not just the epigenetics, and all these are hip, etc. But look first at the clinical parameters, at strength, at endurance, at cognitive function. And these are also clocks.
Yes. And I think Brian Johnson, in particular, with the documentary Don't Die, has brought these clocks into popular conversation where he's measuring, was he reversing the age of his heart and his heart age versus his lung age, et cetera. So now people are thinking about this. And I think it's also interesting that now you can have your entire genome mapped for under $400. Just curious your thoughts on whether or not that's valuable and whether or not you do that at Chi.
Yes, absolutely. We are measuring the entire whole genome, but the question again is, you're getting it on a very nice looking glossy PDF most of the times. And then what do you do? How do you interpret that? What kind of gene sites are you looking at? So it's not about that we cannot measure it for $400. But the
Mhm.
question is, what do you do with this information? Where I think it comes from, it's something like consumer wellness versus, okay, we are now using that, interpreting it in a way that we can use it medically to guide individuals into certain interventions.
At Chi, do you do specific cognitive and brain diagnostics, and how early can you detect that someone might be at risk or in the early stages of dementia or Alzheimer's? And then what kind of intervention would you do?
Yeah, I would turn it around. We absolutely want to prevent mild cognitive impairment, MCI, and also the stage of dementia, of course. But think about at the age of 30, you want to optimize your cognition. How can you think smarter? How can you be brighter? How can you be faster in your daily activities? So, how can you use your brain to
Mhm.
maximize your functional abilities? Yes, of course. Our brain functional screening is roughly an hour, 1.5 hours, using neuropsychological tests. Next to that, we also have a psychologist who is actually talking about the brain. Are you anxious? Are you depressed? Because the brain can function, but if there is psychological disorder, your brain is not going to function. So it's not the biology per se in terms of risk of dementia at that moment in time, but it's a mood disorder. So it's very
Mhm.
important to look at the brain from different angles. Yes, we are doing MRI scans of the brain to actually see how the vasculature is and if we should lower the blood pressure even more. So we are looking at connectivity. And what we also recently introduced while including Sparked into Chi, which is now belonging to the Chi family, is a brain gym. So what we
Ooh.
do is we are testing double tasks. I'll give you an example. Especially in cities, what we normally do, we are going from one appointment to the other. It's good you're walking, but what you're also doing is doing your emails and sending them. So you're busy with your smartphone. That's double tasking. So you're walking, you try not to be run over by a taxi driver, and you're doing your emails. And the accuracy of these emails is lesser compared to behind the computer because we are double tasking. So we are making these kind of processes, we are testing how good is somebody to react to situations, and we are training that. It's not that we want to train to be even faster while walking
Mhm.
and answering the emails, but we want the brain is connected to the rest of the body. Because very often we are missing that. We are either training our body in the gym with resistance exercise training or endurance training and forgetting our brain. Like we are listening very often to music, but why not training your brain while being in a gym? So we have a brain gym where we are combining it. So first we are testing, and then we have very personalized precision interventions for our clients to make them even smarter and faster and prevent the aging process of the brain.
Hopefully, that will be growing globally soon. So, in the series, we've talked a lot about different lifestyle interventions around longevity, but I think it'd be really interesting to get your perspective on therapeutics and where you use exogenous molecules as part of your treatment plan. I think people are really curious about some of these therapeutics that might be coming down the pipeline that are still a little more experimental, but that doctors like yourself are using.
Yeah, so our clinic, Chi Longevity, is evidence based, which means we first need the evidence. It has to
Mhm.
come out of human randomized controlled trials, and then we are applying it. So I know that the practices within longevity clinics might differ. There's a huge heterogeneity what's happening at Chi, and also how I teach other physicians, healthcare professionals, and how I help others to set up clinics. It's really evidence based because I do not want to harm anybody. So we are not the clinic injecting peptides. We are not injecting any stem cells because these are all still in research. And that's what I'm doing with my head on as the director of the NUS Academy for Health and Longevity, where we have all these randomized controlled trials. And we really see compared to the placebo that it works, go for it and go for the clinical practice and we can write guidelines. But we do very, very exciting stuff. So even with diet, if you do it in a precision way and you know what kind of molecules are in our food, it's
Mhm.
so powerful. It's so powerful. It's not only powerful to lose weight, we know how to do that, but it's powerful to activate certain mechanisms, the mTOR
Mhm.
pathway, etc. You just need to know what you want to activate, and you need hugely to know what is in which kind of foods and how much you should actually give. So with the precision gerodiagnostics, where we know what kind of genome we have in front of us, what kind of phenotypic characterization, so how somebody is really functioning, how the microbiome is interfering with the genome and the epigenome, we can then really titrate the diet of individuals. We do that the same way for physical activity. So we really know when to do what and what works to build the more beautiful muscle and help satellite cells to be activated and to become smarter and better. But we also include nutraceuticals. It's called supplements. I think there's a huge overuse of supplements because they are not being given for its purpose. So we are giving, in a very precise manner, nutraceuticals for pathways we first measured. So first we identify a problem, then we are giving a solution, and then we are measuring again. Based on that result, we are either titrating it up, giving it other dosage, or we are giving another combination, or we are stopping something and we are giving a new one. It's the same as in normal medicine. In normal medicine, nobody would give a drug without measuring beforehand and afterwards if it works. And then you are starting with combination therapies. So we are applying the same at Qi Longevity, very precise manner. We only give the things a person needs to antagonize the aging process. And of course, we also give repurposed drugs. Think about metformin, ACE inhibitors, there are the GLP-1s, etc. But it depends on the phenotype. Very often I get questions, well, Andrea, what kind of supplements and what kind of drugs should I use? First, we have to diagnose what kind of disease you have, what kind of aging phenotype somebody has. And then we are giving in a precise way, and we are titrating and we are measuring and we are adapting it to my needs, because everybody here in the room and listening is aging totally different. Of course, we have commonalities. We all become a little bit gray, having a little bit more fat, having a little bit more wrinkles, coming slower. But how this happens is very different and where it happens. And then, of course, there is the future we are not yet doing at Qi Longevity of molecules. Yes, I love stem cells. I would understand why they would work, but in whom and how and at what situation, what kind of pre-treatment, that's important. Because I think very often it's a waste of money. I think it's challenging for the body to just get new stem cells in an old environment. First, you have to clean up the environment, you have to prepare, you have to have the right dosage, etc. So everything in terms of therapeutics where you don't measure beforehand and not afterwards, you're spending a lot of money, consider maybe not doing it.
Is this something that's changing quickly? Like right now, people seem comfortable with metformin and rapamycin, but as you're talking about these peptides and stem cells, is that 5 years away?
I would not like to hear that people are comfortable in using metformin, because metformin can be harmful in younger individuals. And very often I get people in the clinic, and actually we have to deprescribe it because metformin is good where there's a need for metformin. So it's called antagonistic pleiotropy. So it's good in one situation, it's bad in the other situation. So you need to have a matchmaking that is actually beneficial for you and that you need it. So be careful. Metformin is great if you have prediabetes, if you're a little bit older, if your VO2 max is not as good, if you have enough muscle mass. Good, great. But not if you're already the body lifter. Don't do it. Like, it will be harmful. Same for rapamycin, same for GLP-1s. You need an indication. Stem cell therapies, there is much research in the disease space, not much for the indication for longevity. Hopefully we have the next coming randomized controlled trials in 3 years' time, and then it could become a little bit more mainstream. I think we are really lacking data. If you're looking at the stem cell space, there's only one study comparing frail individuals without a control, giving a couple of million stem cells and looking at outcomes which might not be as relevant for younger individuals. So it's really being sold and hyped on the basis of not much evidence.
Super interesting. So I think a lot of critics think that this rapid rise in the longevity sector is the failure of healthcare, right? Especially in the US where it's so hard to access doctors. And people believe that healthcare should be providing a lot of these diagnostics that we're talking about, as well as therapeutics. Do you think that the convergence of longevity and healthcare is inevitable? And does wellness play a role? If you think about those three sort of silos of wellness, longevity, and healthcare, how do you envision them coming together and collaborating?
So they all should be together because it's a continuum. I think wellness is very, very, very important, super important, because that determines hopefully how you feel. And it has a huge impact. I think what we did not do yet is what is wellness and where is the intersection, because there's such a gray zone. Where does the medical field start? Is the sauna wellness or is it medical? I would say it's wellness, but I also use it for my clients because I know it works and there are studies. A nice meal, is that wellness? I use it as a medical doctor because I'm trained in nutrition. So, where does it start and stop? And I think we have to learn to use the same tools, but then a little bit differently, advertising them very differently with different claims. I think that's
Yep.
important. So we have this big gray zone. We have to now interfere and try to disentangle that a little bit. But we have to work together. But we need to know what is medical and what is not wellness, and which
Mm-hmm.
terminology do we actually use. And in the end, we call it longevity or health longevity, and that's the outcome. But
Mm-hmm.
the outcome we are sharing the tools, but how do we live it? That's different. So we have to work together. I'm infiltrating hugely the normal conventional healthcare system because I'm a hospital manager. That's easy for me because I speak their language. So we are infiltrating hospitals in the public system with longevity clinics. In 2023, we started a longevity clinic publicly funded in a publicly funded hospital in Alexandra Hospital in Singapore. I wanted to infiltrate into the public funded system. Think about the UK NHS. We have a couple of these clinics, for example, in the US, Mayo Clinic, also now having these kind of longevity clinics.
Seeing that Abu Dhabi Department of Health last year became the first government agency to set regulatory standards for longevity clinics, which seems like a very promising road for the future. So it would be interesting to hear about the goals of the Healthy Longevity Medicine Society.
Yes, so I was the chair of that committee to write the first standard to certify the first health and longevity medicine clinic. And we hugely worked together with the Department of Health Abu Dhabi and also the Institute for Healthier Living. So the Health and Longevity Medicine Society is a peak organization for healthcare professionals, but also wider. So people in the wellness space are absolutely invited to join. Of course, we need that intersection where we are writing standards and guidelines. So what should we measure? Who is defining what a therapeutic is? Who is defining what kind of diagnostics we should use? So we are giving advice at this moment in time, and we are writing the first standards and we are writing guidelines. So the standard is, for example, what is a longevity clinic? What we hugely defined already in that paper, which was published and signed off in October 2024, is what kind of gerotherapeutics somebody should and not use. So we have a red light system where we say, yes, dietetic control, absolutely. Yes, we give repurposed drugs, but maybe not stem cell therapies yet. So we are defining the space where we think, okay, here is enough evidence to really roll it out and also be able to ask the health insurer to pay for it, because in the end, we haven't touched on that yet. The wellness sector most of the times is not being paid by the health insurer, but how is it going in the medical system and who should actually pay? So the Health Longevity Medicine Society is really now globally active. It's a global organization. We founded in 2022. We have many members, which are healthcare professionals, but we are open for other members too. We have case sharing sessions. We have a young HLMS, and to really bind and the youngsters together to really build a very, very good basis and for the next generation of healthcare.
Great. And I always love to ask as a host when I get brilliant people on like you to hear about your practices, what you're doing for your own longevity. So, Dr. Maier, could you tell us a little bit about the longevity practices that you find most beneficial?
Yeah. So get to know yourself. I think if you don't know yourself, there's a problem to start with. Knowing what your weak points are, knowing what your strengths is. And I'm not just talking about your genome, but also from a psychological perspective. It's very important. How do you react to stressful situations? So I'm not only measuring myself very often, but I know how I'm tracking. It's not only that I'm learning from it, but I can make the decision, do I want to do something? And does it fit at this moment in time in the lifestyle I have and what I want to achieve? If I'm traveling, my scheme is very different if I'm not traveling. What I learned in the past 2 months is really working on my gut health and is working on my endurance, because I thought, okay, it's a little bit screwed up. The diversity of my bacteria and viruses is not good enough. And we went on vacation and we just ate vegan. I'm already vegan, but my husband was then also vegan. And really only eating non-processed food in the most rural area. And I continue that now here in Singapore. And I'm feeling so much better. I stopped all the supplements I took based on what I needed. I measured myself again first, and I measured again, and I'm already 3 years younger, using blood clocks, etc., just on being on vacation, so that helps. But I'm feeling so much more energetic because I do not at the moment go out for dinner. I cook myself, and that's so much, it's so refreshing. But being very, very busy and doing what kind of proteins do you need, what kind of fibers, what kind of ingredients. So at the moment, it's really physical, and it is that hugely influential diet.
That's the perfect segue to my last question, which is, how do you balance the pursuit of longevity with the desire to enjoy life and its various indulgences?
Life is short and you have to enjoy. So most importantly is, if I don't feel happy, I don't care what my body is doing. I need to feel happy. And luckily, people who are feeling happy most of the times also have a happier body. So really feeling happy and feeling energized. So that's most important. If I have the desire to eat unhealthy, I do that. It's fine. Look, everybody needs a treat at certain times. I love my glass of wine with friends. Of course, I'm doing that. It's about shared decision making with yourself. What do you want to become? Who do you want to become? How good what do you want to be? How much do you want to optimize? And how much, not in terms of finances, but especially in terms of time, do you want to invest? And that's most important. And we have calculations now where we can say, if you do this, then you would reach this as a result. So we can quantify it. And very often the ones who are now the early adopters in health longevity, they are coming out of the finance field and they want to know. And now we have the calculations. We can say, if you are changing a little bit of this, this is the outcome. So you can choose. It's a little bit like the wealth investment. Are you high risk, low risk? You can do the same for the body, and that's health investment.
Exciting time to be alive. Thank you so much for joining us today. This has been an incredible conversation. And if someone wants to find you, where should they go?
Watch LinkedIn, Andrea B. Maier. Look at longevityacademy.sg and look at glongevity.com.
Dr. Maier, I'm so thrilled to welcome you to the Wellness Roundtable. Thanks for beaming in from Singapore.
Thank you so much for having me.